One of the most common questions I am asked in my clinic when advising about tests is which digestive test is right for me. The main question you're trying to get an answer for is what are the causes of your digestive problems. If you think of your health picture being like a jigsaw puzzle, we need to find out which pieces are in your puzzle and the size and relevance of those pieces to you and your symptoms. This will enable me or a practitioner to create the best plan to address any imbalances. So the more information you can get, the better placed you are to be able to implement a comprehensive and effective plan. The tests I'm going to discuss and compare for you today are the Smart SIBO breath test and two comprehensive stool tests, the GI-FX and the Pathogen Plus GI map. I often run a SIBO small intestinal bacterial test, as up to 84% of cases of IBS are actually SIBO, and this is the only test that can measure an overgrowth of bacteria in the small intestines. And depending on the type of SIBO you have, whether it's hydrogen, methane or hydrogen sulfide, depends on the treatment you would have. However, to complete a full picture, it's often necessary to also do a comprehensive stool test. The stool tests measure bacteria levels in the large intestines, along with checking for yeast and parasites and digestive function. Both of the tests I like check for pancreatic function, absorption, calprotectin, which is a marker for inflammation used by the NHS to differentiate between inflammatory bowel disease and irritable bowel syndrome. Secretory IgA, which is a marker that reflects immune system function within the gut and is important for barrier function or leaky gut, and tells us if your immune system can fight any intruders or if it's already on red alert, busy fighting. Beta-glucuronidase is included in both the tests as well and is a marker for toxicity in the bowel, and both tests now allow zonulin, one of the few markers that can be used to detect leaky gut or intestinal permeability, to be added on. The GI-FX also checks for protein digestion, fat absorption, short-chain fatty acids, more markers that are important for the health of the gut wall, and it tests for occult hidden blood, which can indicate bleeding higher up in the digestive tract. The GI-FX then looks at 24 commensal bacteria via PCR, which is looking at the DNA of bacteria, to give an overview of the microbiome. This test also cultures, which is growing in a petri dish, good and bad bacteria and yeast such as Candida. If any are found, a sensitivity panel is produced which tells you which natural plant-based supplements and which pharmaceutical drugs would be effective to help to treat them. Parasites are then checked by the industry standard O&P recovery, and the Pathogen Plus GI map on the other hand checks of good and bad bacteria, yeast and parasites, all using the PCR DNA testing. This means that there is no risk of missing any of the bad guys because they didn't grow in the petri dish. The GI map includes organisms that can be hospital-acquired infections such as C. difficile or norovirus, foodborne illnesses such as E. coli or Salmonella, and H. pylori. Deciding which test to do can be tricky, but if your digestive issues started after a bout of food poisoning or travelling abroad, then the Pathogen Plus is probably the one you want to go for. If, however, you want to do a more thorough check of your digestive function, how well you're digesting and absorbing food, the GI-FX is the test to choose. Your doctor should be able to understand the majority of the results for the stool tests, as the NHS use some of the same test markers. However, some of the test markers are more up to date or more detailed than the basic NHS tests. To help you and your GP, we do send out a detailed interpretation guide, and you are free to ask us any questions about the results, or you can book in with the IBS and SIBO clinics to get a full plan based on your history, symptoms and results, should you choose to do so. So to summarise, for a general digestive investigation, to check for overall function and imbalances, I tend to use a SIBO small intestinal bacterial overgrowth breath test along with a stool test. Either the Pathogen Plus GI map, which I use when I suspect bad bugs or if symptoms came on after travelling abroad or food poisoning, or the GI-FX when doing a more thorough check of digestive function. Having this detailed information gives you a really good picture of what is going on in the gut and enables you to start working towards addressing any of the imbalances that show up in a specific way rather than a shrapnel type approach where you keep trying things and hoping something works. When an imbalance is found on a stool test or a breath test, we know the correct things to do and in the right order to be able to address those findings and your symptoms to bring you back to better health. The tests can also highlight times when you may need further investigations done. For example, further testing is usually warranted with a raised calprotectin. In this case, we would refer you back to your doctor. If you would like more detailed information about these tests and the markers they check for, please email us and ask for the Comparing Digestive Testing document.